Health officials are predicting a coronavirus vaccine will be ready by April of next year. 6 months ahead of that timeline, the state of Tennessee is releasing how it will distribute the vaccine. WM Section 5's Kelly Roberts has the breakdown of the new plan.
The reality of a coronavirus vaccine and the return to normal is becoming more clear as the state of Tennessee is planning on how it will distribute vaccines when they get here. Here's the breakdown. 5% of the vaccines will be distributed to all 95 counties equally. 85% will then be given to areas per population. And the final 10% will be held by the state to administer in high-risk areas.
At first glance, are hearing a reasonable kind of preliminary plan.
The state's plan was released Wednesday, but officials say it was submitted to the CDC by the Tennessee Department of Health and other agencies last week. Baptist infectious disease Dr. Steve Threlkeld says it's most important to get the vaccines to the most vulnerable, like nursing home residents and those who are most likely to catch it. But that latter determination may take some debate.
I hear people saying, well, they'll probably be given disproportionately to healthcare workers first because they're on the front lines and they're around cases. And though that may be true, the reality is that if we're wearing PPE, the personal protective equipment all the time, the real rate of transmission to us may not be as high as a restaurant worker, for example.
The state says to help develop the plan, it took framework from the CDC and National Academies of Science, Engineering, and Medicine.